substitute from Nancy right now. Substitute for Nancy at the moment.
Okie doke. Nancy Sattler is our chair of the Ohio Math and Science Coalition. We are a group that's 25 years old, and we have been looking for sustainable continuous improvement in PK through 16 mathematics and science, and all the things that are subsumed under that, such as technology. And tonight we're talking about nursing. We are hoping to get more people interested in going into the profession by providing extra information for you here. So we're going to, let's see. And Mary Ann Hobus is going to be our moderator for the meeting. She is the one that was able to tap this topic and find participants for our panel. And she has picked expert people to share with us the information that you're going to hear tonight. Mary Ann has taught for over 45 years, and she is a Distinguished Service awardee from the Ohio Mathematics Association of Two-Year Colleges. So Mary Ann, do you want to go over the norms, or shall I read them?
You go ahead.
Okay, we want to make sure that on the people that are watching this, not the participants, that you have muted the sound on your computer, but you can open the chat section. It's in the navigation label under chat at the bottom of your screen usually, and you can ask questions in there, or you can direct a question toward a specific speaker, or you could do it in the question and answer section. Be sure you click the switch from panelists to all panelists and attendees so everyone can view your comment. Otherwise, it only goes to one person. And please be professional in your comments. Let's put it that way. If you do have any burning questions, if you put them in the chat or the question and answer section, we'll get to them if we have time at the end, if that's possible. Tonight, our panelists, Mary Ann, is going to start with our introductions there.
Okay, thank you very much. In addition to our panelists that were on the flyer that many of you have seen, I'm very pleased to also welcome Dr. Hazel Holmes, who is part of the faculty at Rhodes State College. After the introductions, which we're going to do first, I have several discussion questions that we're going to talk about. And I'm going to have to, through the discussion questions, to make sure that we have enough time to answer some questions at the end. I may have to come in and cut someone short. And so I apologize in advance if that happens. Okay, without anything else, let's go. Petra, do you want to introduce yourself, and then we're on?
All right. Well, welcome to the webinar, everybody. My name is Petra Lennon, and I'll be one of your panelists this evening. And just a little bit about myself. I originally received my nursing degree from Penn State University in Pennsylvania. So if I talk a little bit weird, it's my Pennsylvania slang. Then I went further and received my master's degree in nursing education. So my expertise or my experience includes working in intensive care, cardiac critical care, surgery, nursing supervision, and telemetry, med surg, and also, though, I do want to say that I started as an STNA in high school. So an STNA is a state tested nursing assistant or a nurse tech. So I was able to work as an STNA while I was in college and in school. So I then decided I was very much interested in education, and I started at Rhodes in 2005 as a clinical adjunct instructor. So what that means is I was teaching clinicals only on a certain day of the week to nursing students, but I was working my regular job as well. Then I transitioned after my master's degree with education. Then I joined Rhodes full-time to include the didactic portion to teach in the classroom. And I'm also the clinical coordinator at Rhodes. So that serves as like a liaison between Rhodes and every single clinical facility. So I deal with administration, managers, and I place every clinical student in a clinical seat. And then just one last thing, in my studies with my master's, I was very much involved with holistic health and alternative modalities. So since then, I've become a Reiki practitioner, and also am very involved with integrated health, which includes the philosophy of balancing physical, mental, emotional, and spiritual for wellness. It doesn't just focus on a physical health, it includes everything. So welcome. I'm very happy to be here.
And you were going to introduce?
And then next in line is Marquette Wilson.
Hello, everyone. My name is Brett Wilson. As Professor Lennon just told you, I'm from Fort Wayne, Indiana. I am a 10-year veteran of the Marine Corps. After graduating from the University of St. Francis, which is the one school that I jumped into after I left the Corps with an honorable discharge, mind you, job within healthcare, but it was more on the business side. So I dove into marketing. At that point, I became the marketing director of a long-term care facility in Fort Wayne, Indiana. I did that for about 6 or 7 years. And then I decided that, hey, I really want to be closer to bedside. So I was turned on by nursing right away, kind of shied away from it, but then I doubled back and said, let me grab my RN and see how far I can take this. For me, the end game is a nurse practitioner. But for right now, it's just all about passing my boards, getting through my first or second year of experience and moving forward from there.
Terrific. Thank you, Mark. Would you introduce the next person in line, please?
I don't see the next person, but I'll go ahead and pass this to a fellow classmate of mine, which is Ben, and he can take it from there.
So I'm Ben. I am from Bluffton, Ohio. I am a second-year student at Rhodes State. I'm getting ready to graduate this fall semester. I've been in healthcare for roughly 3 years now. I started working in a long-term care facility as a state-tested nurse aide. I worked there for about 2 years, and then I recently, within the last year, took a job at St. Rita's Medical Center in Lima, and I work on a neuroscience step-down floor. And so I have learned a lot from there. My end goal is to work in ICU or in the intensive care unit. But for right now, I plan on working on the floor that I'm on as soon as I graduate.
Well, congratulations for your excellent goals for life. Would you please introduce Peyton?
Yes, Peyton.
Okay. Hi, my name's Peyton. Thank you for joining us. I am from Bluffton, Ohio, and I started my healthcare journey when I was 16. I was an RNA, so I didn't have my STNA quite yet. I was just a resident care aide, and I worked in a memory care unit there for about 2 years. And while I worked there, I was part of Millstream Career Center. So it was a technical school that I went to while I was in high school. And the program really geared towards getting your STNA and starting your college classes. So I was actually a college credit plus Rhodes State College student starting my junior year. So my first year as a junior really focused on medical terminology, and that was huge. That has really, really helped me in my nursing career. After they got medical terminology, my senior year, the first whole part of the year was focusing on getting your STNA. So I got my STNA in December of 2019. And then after that, I took my pathophysiology class through Millstream as well, which was through Rhodes. And after I graduated high school with my STNA, I started working on an oncology floor at Blanchard Valley Hospital in Findlay and also in the ER. So I liked to work in a lot of different units. I cross-trained in every unit except for OB at Blanchard Valley. So I like to kind of bebop around and get to know everything I possibly can. When I went into college, I had every prereq done except for my A&P. So my first year at Rhodes, I just took my last A&P course, and then I jumped right into the program when I was 19.
What is ANP?
Anatomy and physiology. So that was the only class I wasn't able to complete in high school. So I did a lot of my college courses in high school as a college credit plus student in Rhodes. So that was, looks like the chat is disabled from somebody. Okay, sorry. Somebody put it in a message. Anyway, so I lost my train of thought. Where was I? Oh yeah. So I jumped into my nursing program and I'm now in my 4th semester. So I'm set to graduate in the fall.
Excellent. And our last panelist is Dr. Hazel Holmes. And let's hear about you.
Hello, I am Dr. Hazel Holmes. I am the PN coordinator for Rhodes State College. A little bit about myself. I also started at a young age, 16, as a nursing assistant back when they didn't have to be state tested. I was a nursing assistant for about 6 years. Then I went and got my LPN, or licensed practical nurse. Moved into my RN and have worked all the way up to my doctorate. I have been in nursing education since 2007, and I absolutely love it. Nursing is a wide career, as we'll talk about tonight. There's all kinds of opportunities for you in this career.
Excellent. Well, let's go on to some discussion questions then. And the first is, what jobs are available for nurses besides just being in the hospital? And Hazel, do you want to start a bit? And then Petra, you want to take over?
Sure.
There is a wide variety of availability for nurses, depending on what your interest is. That could be anywhere from working with children and pediatrics, OB, obstetrics, surgery, emergency room, working in a doctor's office. It could include being a flight nurse, which is critical care, occupational health, forensic nursing, outpatient, education. I mean, the sky is the limit for nursing. There's really so many avenues and pathways that you can take to accomplish what you really feel like your purpose is. So yeah, the sky is the limit with nursing.
Hazel, what did you want to add?
Some of the other things that Petra didn't mention was like dialysis nursing, where you work with patients who have kidney failure and you help them through their dialysis session. You educate them on kidney disease and kidney health and how to keep that going. There's nurse anesthetists where you can work in the surgery, and with that, you can move into nurse practitioner. And work at bedside, that kind of thing. There, as Petra said, the sky is the limit. It's whatever you want to do.
I saw a list today of specialty careers in nursing, and one caught my attention that I believe I had never heard about, and that was informatics nurse.
Oh, yes.
Yes.
What is that?
Informatic nursing, they specialize with like computer charting, and like, for example, different facilities have different programs in which they chart. Locally in Lima, we use a big one, a very popular one, actually nationwide, is Epic. And so those individuals, those nurses, they train the staff, they train the physicians how to navigate through the charting system.
And it's a big charting system today.
Yes, it is. Yes,
Today.
it sure is. Because nurses are very detail oriented and we have to chart everything. If it's not charted, it's considered not done. So that's a very important job that our informatic nurses need to teach everybody how to navigate through those charts.
Amazing.
Ryan and Marquette, did you want to tell us what you're going to be doing?
Sure. So another role within nursing is a little bit off the beaten path, and it's instrumentation and sales. So that pertains to surgical instruments, implants, and things of such that a physician or a surgeon would use in a surgery, such as in my case, it's a spine surgery. And so all other orthopedics all have vendors or reps that they go through to get the instruments, the implants, synthetic bone, and things like that, that companies or producers engineer. Companies such as Biomed, Zimmer, Synthesis, these are all companies that engineer and they create instruments, artificial bone and things like that, screws, rods, cables, anything that can help produce successful surgeries within the orthopedic department. Well, for me, what I come to find out was in order to obtain that position or those type of positions, you need to be qualified. And one way to do it is to become a registered nurse. Once you
Oh my
become an
goodness.
RN, yeah, you can kind of dive into that too.
Thank you. Benjamin,
Mhm.
what did you want to add?
I think another big area that you can go into is quality. So quality nurses, I guess the best way to describe it is that they are like, they watch everything that you do and they make sure that you don't make certain mistakes. So if you've ever been in the hospital and you see a sign in the room that says gel in and gel out, that is an infection prevention measure. And they kind of deal with things like that along with infection control nurses. But they just kind of make sure that you are doing everything as you should be.
Wow. Peyton, did you have something to share too?
I have really thought about a lot of different professions. I've cross-trained on a lot of them, so I know what I don't like. So there's so many options, and you kind of have to rule out this isn't for me or this is for me. And it's kind of hard to picture yourself doing one thing. So I think a great way to start if you don't know is med-surg. You're going to get a very well-rounded education on the job. And it's something that knowledge will never be wasted. No matter what profession you go from med-surg, it will be used and you'll see all different kinds of patients. It's kind of the hospital's dumping ground. They don't know what to do with the patient. That's where they're going to go. It's not very specific. You're going to see a lot of your diabetics, your geriatrics, but you also can see Crohn's, pretty much anything you can think of. And then my plan is after I get some training under my belt with med-surg is to do PACU, which is right after they come out of surgery.
Excellent.
Thank you very much.
I'd like to move on to then, okay, so there are many careers in nursing. Marquette told us about he needed to become a nurse so that he could do sales, for instance. And so would you like to begin to explain the different degrees in nursing, Marquette?
Sure, no problem. So the first initial degree that anyone can obtain as far as with the correct schooling and education is your associates. So me and my fellow classmates, we are obtaining an ADN degree. The next level up is your BSN, which stands for your Bachelor's of Science in Nursing. So you go from your associates to your bachelor's, and then from your bachelor's, you pivot forward into your master's level, or in nursing, we call it your MSN. So your master's level can go two pathways. Door number one, which is education. So your master's of science can take you to more of a theological route where you're going into college teaching, or even any type of educational, that is, I should say. And then you have the practical world, hands-on still, so nurse practitioner route, which is my route. So with the nurse practitioner, you're still a master's of science in nursing, but you kind of specialize what you're going to go into as far as nursing as a whole. As we all know, there are so many different levels of nursing that you can do, but when you get to the master's level, you kind of have to dictate if you're going to go the educational route or if you're going to still stay bedside and practice.
Thank you.
And then their last level, which is what Dr. Hazel has done, is your PhD.
Okay. Hazel, do you want to explain then what a licensed practical nurse would be?
Sure. The licensed practical nurse is, they go to school for 1 year, and they work directly under the supervision of the registered nurse or RN or a physician. They do have LPNs that work in various doctor's office settings. They can do whatever is in their scope of practice. Scope of practice is defined by the Board of Nursing. Every state has a board of nursing, and based on whatever state you live in will dictate what your roles and responsibilities are according to that state. So it's real important and this is for both the LPN level and the registered nurse level. So it's important to know that if you change states, if you move from one state to another, you have to know what those rules are. And then the registered nurse is the 2-year degree, as Marquette had explained. And then up to the terminal degrees that he had mentioned, the doctorate level, there's actually 2 different levels for that. There's the PhD, which is the Doctor of Philosophy. And this role, you're going to do a lot of research. You're going to find out what makes things happen. You can research diseases or conditions, medications, research medications, things like that. This is really removed from bedside. You're basically working in the lab area or a research area. The other part of that is a doctorate of nursing practice, which is what I have. And this one is geared more toward taking that information that the PhD has found, so all of that research knowledge, and bringing it back to the bedside. So with the DNP, you still have some at bedside acts, and you can still provide care. You have to know how to do the research, so you will learn how to go about getting all those things put together and what it all means with those numbers, but then you take it a step further and bring it back to the bedside.
Thank you. Petra, do you want to explain then the RN and the BSN, that if you decide to, and I think I know this, but if you decide to go directly and get a BSN, you get your RN within that degree?
Yes.
And if you get an RN, then you can
so
go
there
on
are
and get.
options. There are options. Out of high school, after you have your high school diploma, you can go into an associate degree, which is the 2-year, or you can go straight through to a BSN program. That was the route I took. Out of high school, I went straight to Penn State and pursued my Bachelor's of Science degree. So I kind of skipped over the associate degree and went straight for the bachelor's. So that's an option too. We see a lot of traditional students do go straight to the BSN.
Right, but as part of the BSN, you get an RN. You become an RN.
You can become an RN, yes.
Yeah,
To
you
become an
can.
RN, you have to take that NCLEX exam.
Right, right.
Mhm.
Okay, okay. So I thought it would be well, okay, shows you what I know. I thought that you would automatically work on an RN as far while you're doing your BSN. But if you have a RN from, say, Rhodes State College, then you can go ahead and at another college get a BSN.
That's correct.
And so
That's correct.
So all the degrees in nursing, you have many, many different options and many different ways to go. All right, let's
Yes.
move on then real quick then. The next question is, or discussion point, I really like to think of them as, what courses were helpful to take in high school? What courses were helpful to take in high school? Benjamin, let's begin with you with the traditional high school, and then Peyton, let's follow up with what you did at the Career Center.
So courses that would be smart to focus on would be any of your science and mathematics courses, which some high schools offer a broad range of science courses and mathematics courses. Other schools offer what you have to graduate from high school. But obviously, doing math is important because we have to make sure that we verify like the dose and the rate and everything that we have to do. Also biology, anatomy and physiology, pathophysiology, pharmacology, chemistry, all of those ultimately will get used in some aspect in your career. And oftentimes you will have to take classes like that in college. So if your school offers advanced placement classes or CCP classes, most of the time, some of those credits can be honored for school. So then you can decrease your workload while you're in the program.
Excellent. What about, are there any other types of courses, Ben, besides as many science courses you can get and being certainly competent at mathematics that you might recommend?
I also think that if you are able to do like a public speaking class or something of that nature, because some people are very shy and very timid and other people are very open. But I think that being able to know how to have a conversation and hold a conversation with somebody is very important. Especially because sometimes the patients just want us to listen and they want us to be a support and not just the nurse that's taking care of them. So sometimes they will ask us questions that aren't just related to nursing, and you have to know how to be able to respond to that in a professional manner.
Peyton, what was helpful for you?
Yeah, so we actually just got a question about intro to health science and other career tech courses. So I was very avid about, I wanted to get the best education for my time. I like to live on a schedule, which is not always a good thing. It's very stressful. But at the same time, starting my sophomore year, I wanted to start taking college classes. So I kind of used my college classes as my high school classes. So instead of taking English my sophomore year, I took college English, and it counts for both. It counts for your high school diploma, but it also counts towards your degree. So, and it saves you money and it saves you time. So if you can do it, I highly, highly encourage that you take a lot of prereqs in high school. So my statistics class that I had to take for my ADN program, I took that in the summer between my junior and senior year of high school, and that counted as my senior year math. And I actually really had to advocate for that because my high school was kind of wishy-washy on it. And I said, I'm working very hard, and this is the same, if not harder, than what my high school classes would be. So like I was talking about earlier, when I went into my junior year, I really wanted to start my college career. And that's why I went to Millstream, which is that career tech school. So when I got there, it was called the Health Professions Program, and they start junior and senior year. they do all of the surrounding county schools. So anybody from the surrounding area schools could go to this career tech school for the second half of their day. So I would go to my home high school, which was Arlington, until noon. And then I would go to Millstream from noon to 3. So I had my lunch break, and then I would go and I would start my career tech courses. And that's where I started medical terminology. I will stress this to the max. Medical terminology is not a requirement for the Rhodes State College ADN program. It should be. It really, really should be. I have not appreciated any other class more than I have that one. If you can't understand the basics of what a word is trying to tell you, it's going to be harder to understand the concepts behind that word. So when I hear hepatitis, I know that itis automatically means inflammation, and I will never forget that. And that applies to any word that you read in a book or you see on an exam. So if you can take a medical terminology course through a career tech school, or even take it as an online college course during the summer through Rhodes or Owens or a college like that, it allows you to gain those college credits for free, and it will get you ahead of the game. It gets your mind working. And then we went into medical law. So that really focuses on what you guys were talking about earlier, like your scope of practice. So they really, really stressed, this is what you can do and this is what you can't do. So the medical law may not be the funnest and most hands-on class there is, but it's something that you need to understand in order to do this profession. And then once I went into my...
Who advised you to do this this direction of taking classes?
So my freshman year, Millstream came and did a presentation at my high school and was talking about college credit classes and, you know, the structure of how Millstream worked with your regular high school. And I liked that variety. I liked the difference. You know, I didn't want to be like every other college student. I wanted to stand out. I wanted to make myself look special so that when I was done, that an employer would look at me and see that.
I think you accomplished that. That's for sure.
Yes. And I'm not saying like it definitely isn't easy, but it is so worth it. So worth it. And once you get into that STNA course, which an STNA is required to get into the Rhodes nursing program, you have to have that STNA. And I think that's super important. And you don't have to take that through a career tech school. You can take that. There's so many different programs out there through different companies that you can do. But Millstream just kept it a little bit more structured and paced so that we had a higher pass rate. So definitely that STNA class helped me a lot. We took our boards, and again, it was all for free.
Excellent.
Yeah.
Well, that leads into taking nursing classes. So we've now got ourselves into the nursing program, and there's many classes we take, but some of them are nursing classes. And while in the nursing classes, we learn different things. And then there are labs on campus where we can, I believe, practice some of the things we've learned in class. But then there's another level, and this is called clinicals. And let's see, who would like to really introduce the concept of clinicals? Petra, you're in charge of them there. Why don't you start with what is this? What does this word mean? What is clinicals?
Okay. Clinicals, every nursing course, an NSG course, has a clinical component to that course. So nursing students have the didactic portion where they learn the theory. And then they have a day of clinical where they apply. What they learned in the classroom, they apply to the clinical setting. So this is where they have their hands-on skills. and they provide complete care for the patient, from ADLs, which stands for activities of daily living, everything that you and I have done to get ready this morning, brush our teeth, get dressed, bathe, all those things, to incorporating treatments, administering medications, doing their assessments, and they are supervised by their clinical instructor at that facility that they're assigned to, in that unit they're assigned to. So this is really where the rubber meets the road. They're applying what they learned in putting their hands on it and providing full patient care, just like a registered nurse would do, but they are doing that under the care of a registered nurse. They're not able to do any skill without their instructor beside them. They can't even pass or administer a Tylenol. So they have to, it's very regimented, and that is regimented by our Ohio Board of Nursing. Our Board of Nursing will tell us what the law and rule is as far as clinicals, but that's what it is. It's the hands-on portion of their learning.
Okay. Marquette, can you tell us about your clinical experience? I want to hear from all the students about the clinical experience, at least one or two of them.
Okay. Well, my clinical experiences have been great. I went through my STNA clinical at Rhodes, and I've gone through 3 semesters up until this point of clinicals within the ADN program. I really enjoyed them. They can be kind of stressful at times, but they're also huge gains that I get every day. There has not been one clinical day that I've had that I didn't learn something new, whether it's minute or even huge. Most clinicals have started about 6 or 6:30 a.m. We usually cut them off about 4:30 or 5 at times, most of the time. I think that we are assigned a patient or two, and as you progress through your clinical journey from semester to semester, your patient load increases, as well as the acuity of the patients that you take increases as well. We see some of the toughest things that most RNs see, actually, depending on what floor you're on. We get attached to a clinical instructor, and then we also have access to the nurses that are on the floor within the hospital. The hospitals that I should say went to was St. Rita's, which is in Lima. And I've been fortunate enough to spend all my clinical time there. And the nurses are comparable. They definitely help out. There are things that I do have to research along the way throughout my day. And then as I get stronger as a student nurse, I can see myself accomplishing things a lot faster, with a lot more degree of not as difficult as it was in the beginning of the semester. And I also get a chance at the end of every clinical day, we have a debriefing where each and every nursing student gets a chance to basically give report to the group as a whole, as if they're giving a report to an oncoming nurse. So we get a chance to learn even more so in that last hour or hour and a half of what each and every fellow student went through throughout their day. So
Wow.
the clinicals are nice. I enjoy them.
Okay. Benjamin, can you tell us one clinical? I'm watching time just a little bit. One clinical you particularly enjoyed?
One clinical I enjoyed. Actually, it was probably my first clinical that I ever had. It was my first semester. We were just, as one of my instructors used to tell us, at that point we were just a seed in the ground, and we were getting ready to bloom. They were giving us everything that we needed to bloom. And I think that the first step onto the floor, working as not a nurse aide, was very much different than it was working as a nurse aide, because we were able to do more hands-on care, and care from the patient from point A to Z. So I think that the first day I was relieved of stress, because I thought that it was this big scary thing. It was going to be terrible. But I actually really look back at my first day at least once or twice every semester, and I'm thankful from how far I've came from that point.
Peyton, what
point,
about you? Do you have a particular clinical experience you'd like to share?
This most recent clinical, I got to be a little bit more on a specific floor. Usually I was on more of a general med surg floor, but this floor was a neuro floor. So all of their strokes would go to this floor. It was at St. Rita's in Lima. And my clinical instructor was their like stroke guru. She lived and breathed neuro, and it terrified me. And it actually is the floor that Ben works on. So I remember my very first day, I don't know why she scared me so bad. And I was like, oh my gosh, this is gonna be horrible. She's gonna hate me. I'm gonna do an awful job. And you know, I was not confident at all. And throughout each week, you know, she would look at me, she kind of just stare at me. And I didn't really understand why she just would keep staring at me until the very last week. She goes, you know, your professor told me that you were somebody I should watch. And she goes, in the first week, I was like, I don't see it at all. So by the last week, she goes, I see it now. Because you're confident and you're actually showing me who you really are as a nurse and not a scared student. So the more confident you get with your skills, the more comfortable you get with your clinical instructor, the better you are. And the more she saw what Professor Lennon was talking about.
Oh dear, I would love to be a fly on the wall for all of you. My next question, Petra, goes to you first. Do nurses make a livable salary?
Indeed, they do. Indeed, they do. Me personally, being a single mother, I was able to raise my son and daughter without any struggle whatsoever. And there's so many opportunities. I'm a person that keeps kind of busy. So like I always have like a little side hustle going on too. So, but you can have your regular job and you can do other things on the side to supplement depending on, you know, what you want to do. And then, you know, right now we're in such a dire strait for nurses. We have traveling nurses too. So for anybody who doesn't have any attachments, you know, as far as to one certain location, travel is a very nice opportunity for them as well.
And I think I skipped the one thing. Let's, before Marquette answers this question, is it easy to be able to get your degree in Ohio and practice in another state? Is the degree portable?
Yes, it's a national test that's taken nationwide. So it's the National Council Licensure Examination. So there is some things, some technicalities where paperwork, if you want to apply for multiple states or nationwide, it's pretty much like a nominal fee that you have to pay. But for example, I graduated in Pennsylvania. I went to a school in Pennsylvania. And when I moved to Ohio, essentially because I was already a registered nurse in Pennsylvania, I was just filling out an application. The Ohio Board of Nursing would do like a background check on me and make sure everything was verified that I graduated from an accredited school. And then I wrote out a check to them. Essentially, that was the biggest thing. I wrote out a check and then they gave me my Ohio license.
So it's very portable. So
Yes, it is.
If you have a spouse or a significant other that wants to move to another state, that's not a problem at all.
Not at all. Not at all. You could go anywhere in the United States and be able to practice with some paperwork. Yeah, very
Marquette,
easily.
yes. Marquette, you were going to tell us about some of your relatives and whether nursing is a livable salary or not.
Oh, without a doubt. So there's a couple of talking points that I have about that, and I'll be super brief. If I can piggyback off Professional Leonard really quickly, the travel nursing thing is what I know my relatives do. Some of my very close relatives, and during COVID, they were working with a certain company, and they were getting like $10,000 a week plus $1,000 stipend. Now, since COVID has pretty much gone past us, they're dropped back to maybe 4,200 a week for they call it 42 for 36. And some hospitals are a little under that. Some of them are a little over that. It just depends on the departments that you qualify for. Then there's also my lane that I'm going into, which is more of the spinal instrumentation sales. So this is more of a low six figures to mid six figures. And this is something that for me, I felt like I either had to be naive or obtuse not to take a chance and kind of take a stab at that. And so here I am, along with Ben and Ben Payton and myself, going into our last semester.
Okay, so nurses do make livable salaries today. Wonderful.
There was a
Without a doubt.
question about the average nursing salary. Professor Lennon, you probably know that a little bit better than.
That really all depends on, I mean, I know travel nurses, if they're working in ICU, they can make $150 an hour.
Without a doubt.
There's such a wide variety. I know directors of hospitals that are making 500 grand. So it just all depends on what route you want to go. There's no magical number that I can just specify. And like I said, you can always have your regular job and do side jobs as well to supplement your income.
During COVID, I understand, I now live in Cleveland, and I understand from just reading the Plain Dealer, which is the Cleveland paper, how much the nurses were making at the Cleveland Clinic doing some overtime. It was really incredible. They were needed. Yes. Hazel, I was hoping you would speak to this last discussion point I have, although I have a bunch of others we can talk about. And that is, suppose you don't want to be a nurse, but you'd still like to work in the healthcare area. Are there opportunities, say, at the two-year college level? Let's stick to the two-year college level. Are there other opportunities in the healthcare for students at the two-year college level?
Absolutely. The first that comes to mind is surgical technician. They're in the operating room and working with the circulating nurse and that kind of thing, making sure all the supplies stay sterile, that the physicians have what they need. So they see that piece of the nursing. They're not a nurse, but they are doing health related things. There's also occupational therapy, physical therapy, and speech therapy. And those three therapies work together as needed for the patient. Occupational therapy will help that patient relearn how to take care of themselves for activities of daily living. They learn how to feed themselves, how to dress themselves, etc. Physical therapy helps teach that patient how to be physical so they can be mobile. They walk again, they learn how to get in and out of the bed safely, those types of things. And then speech therapy, by the name, you think automatically they teach someone how to speak, which is in fact what they do, but they also teach a person how to swallow safely, so they can, won't choke on whatever it is that they're eating. So they have a lot of different roles for that, but there's all kind of things that you can do in healthcare without actually being a nurse. And you don't have to deal with the needles and the blood and those kind of things that usually is what people want to do about nursing.
Yeah.
I can remember with Rhodes State, college, one of the two-year programs that they had was dental hygiene, and there are not a lot of those programs throughout the state. And so if you're interested in dental hygiene, you've got to find the programs, right?
Yes, we do. There's the dental hygiene program as well that is excellent there.
Okay, Jan, do you have some other questions for us?
I don't have any more of our program questions, but we do have, once again, I can't get into the questions. There are 2 questions in the question and answer section. If somebody could read those, that would be terrific.
I think we already took care of those.
We took care of those. Peyton was on top of it. That's why we have these young people around. Jan. Realize that? I had another question. And then if we have some of the teachers, how might we encourage people at the elementary school level to begin to think about a career in nursing? At the elementary school, we talked about the courses that we might want to take at the high school, but what might we do at the elementary school level to begin to encourage people to think about nursing as a career, or possibly the middle school level? Any ideas?
I would encourage schools to have like career days, and there they can explore, different choices. I know once they get to high school, they can also shadow a nurse, or they could shadow another healthcare profession like PTA or OT, that kind of thing. And, it's very important because you're not going to be locked in. It just helps you to explore those opportunities. We have had many nursing students, and after they finish first or second semester, they've come to the realization that maybe nursing is not what they want to do. And therefore, then they will transfer over to like dental hygiene or medical assistant, or, RAD, which is radiology, something, similar, but not that extensive as, nursing is. So, but yeah, I would say, career days would be a great opportunity for the little ones. Some kids know right out. I mean, I knew as a toddler I was going to be a nurse. Some people, may need to be cultivated a little bit more. Just depends on, their personality and the characteristics that they have. But career day is a very important thing. Another thing that Peyton had talked about was CCP. Very, very valuable. I wish they would have had that when I was in high school. So that is college credit plus, that high schools offer credit courses, college credit courses in high school that are completely paid for by the high school. In fact, Rhodes, just at our last graduation, the first Saturday of May, we had a high school student graduate with their associate degree before they even graduated from high school. So CCP, parents, get on board. I'll tell you, I wished I would have had that opportunity. Those are free credits. That's money in your pocket.
And the only thing that you really like with those classes, there's really nothing for you to lose. All you have to do is get a C average.
Right.
Wow.
And those classes can be the gateway to say, hey, I'm taking A&P, or I'm taking microbiology. No, this isn't for me.
Yeah.
Or that kind of thing. So those are also, and CCP can be offered in 7th grade. Mm-hmm. Starting in 7th grade.
There's a question about math courses that prepare students for their nursing degree. I took statistics, and that counted towards my degree. That's huge. Any like conversions or with calculations are huge in the nursing program. So I took, what did I all take? Let me think here. Algebra 1, college algebra 2, and pre-calculus. And then I took that stats class my senior year. So I thought that was plenty. That's just in my opinion, though.
That's the 4, you took 4 courses altogether, correct?
Yes.
Yes.
So that's the state requirement for that you have 4 math classes, but
she
2
had-
of them went for your degree.
Right.
Yes. So the stats class that I took my senior year counted for my degree and for my high school diploma.
Fantastic.
Yeah.
There's another question from Peggy. She said, is there a nurse shortage? There,
Yes,
so there is a nurse shortage. I want to say this two ways. There is a nurse shortage of nurses working at bedside, but there are not a shortage of nurses in the US. But
that's
they don't all work bedside because of all of the opportunities and the way that they are able to work. Obviously with COVID, you saw a lot of the older generation or new nurses who realized that this was not for them. That was a very trying time for them. That's when everybody found out if this is really what they were there to do. So they had a lot of nurses leave, but I don't believe that there is a nurse shortage, but there is a shortage of nurses working at bedside.
that's a good point.
That's a great way to say that, Ben.
That's fascinating because that's not what I know in the Cleveland area. They are desperate for nurses up in the Cleveland Clinic and all those. They want you all back up there.
Mhm.
Well, and with travel nursing being so lucrative because of the pay, a lot of nurses with a lot of experience left to do travel nursing because they were getting paid for what they were worth.
And that's the truth. Here is the feedback form. If you could just copy and paste that into your browser, then we can find out what you gained from this webinar that we're so grateful that you attended. And our final thoughts are that we were so privileged to have these 5 people join us and to get the variation in from Marquess, who has come back to his lifelong learning to go into a different profession, to Benjamin, who's going to be graduating, and Peyton, who did the, I think you were so wise doing all the planning that you had done. I congratulate you. It sounds like when you were in elementary school, you knew exactly what you wanted to do and how to get there,
Thank
and
you.
to do it without going into huge debt. So we appreciate your information.
Thank you.
Does anyone have a final thought that they want to add to the conclusion here of our webinar on nursing?
Just if anybody has any questions about nursing or the profession, feel free to reach out. I would be happy to discuss different options or further questions. I could entertain further questions.
Any questions about career tech school? I love talking about it. Any questions at all?
Oh, that would be tremendous. And Ben, how about you? What I've got my 5 pictures, and I'm just going up and down the pictures here.
Just any advice, or I don't want to say guidance, but any advice or questions like that that you have about the career or the pathway, just feel free to reach out.
And Marquez, I'm so sorry about mispronouncing your name, which I'm sure I did throughout this whole thing.
You're fine. You're fine. Hey, listen, my thing is this, is that just know that there are so many avenues to go down in nursing. There's so many different facets of the degree. As we stated earlier, that nursing is an art and it's a science. So if you don't like bedside, there has to be so many things that you can do, like me, within the end game of nurse practitioner, to the more immediate thing, which is spinal instrumentation sales. So I just wanted to be clear, make sure that I kind of keep my intent versus impact ratio low. So just understand that, hey, there's so many things you can do in nursing. Get involved and get active.
Thank you. These are the sponsors that we have for our that support our webinars and help advertise our webinars so that people can find out what we're doing through the Ohio Math and Science Coalition. And we thank them very much for that support. And we're really grateful for these people have all volunteered their time, and it was not just the 1 hour tonight. They did a lot more than that. If you would like to see this webinar over again, the recording will be at this website, the OhioMSC.net. If you go to OMSC, you'll get a whale watching location. So it has to be Ohio MSC. And we will be doing webinars again in the fall. So to all the nurses and the future nurses and the people that teach those nurses, thank you so much for your hard work. We appreciate it greatly. Thank you. Goodbye.
Thank you.
Thank you.
Thank
Thank
you.
you.
much.
Thank you.
Thank you,
Thank
Jan.
you.
Thank you, Marianne.
Oh, thanks. Thanks a
Thank
million.
you all.
Good night.
Good
Bye-bye.
night.
Night.
Bye. Bye.
Bye.
I think we've all become friends, don't you?
I think so.
Nice